Another patient here with poorly controlled diabetes, missing her lower left first molar, a simple implant placement without incident. Now, why would I do implants in a poorly controlled diabetic? Well, her diabetes sometimes was well controlled, sometimes not. And, it was very, very difficult to get her under good control. And so we had quite a lot of discussion. Certainly, I used antibiotics prophylactically on her as well as after the surgery, but I couldn't get her diabetic control under a hemoglobin A1C of 8.5. And so we had quite a long discussion and decided to go ahead and place the implant. Now, the reason, of course, I'm showing you this is because she healed terribly, and this is after 1 week, and, really not good healing. And so I kept her on antibiotics, had her really just cleaning around the area of the wound, and then after 2 more weeks, she ended up healing well. But, certainly a compromised case, and maybe caused me to think about this a little bit differently. What about head and neck radiation? And, this is an area that I see quite a bit because I treat a lot of patients that have had radiation and cancer therapy. And when you add chemotherapy to that, it even complicates things much more. And we have these vascular and wound healing problems. So this is a patient who is really has a failing dentition, and the discussion went on quite a long time of how we were going to treat this patient. We decided to do immediate implants with immediate provisionalization. Obviously, an all-on X type of procedure, but certainly on a very, very strict liquid diet, knowing that there could be failures because of his radiation compromise. You can see when the teeth were removed, the quality of bone is not wonderful. You can't see a lot of good vascularity here. Still, again, a fairly low ISQ reading, and our implants placed with the provisional restoration intact, and him knowing that he really needed to be extremely careful because the implant failure rate is quite high because of his radiation. But the reading of 65 gave me a little bit of confidence, more than I would have definitely had without it, to do this provisional restoration. And so this is him. And actually, it's been about 4 years since his prosthesis has been placed, and he's been doing very well and didn't have any loss of his implants. So this is him before and after. So the ISQ values can also give you information to monitor implants over time. This is a patient who had a pretty significant graft with BMP and a titanium mesh. We can see that we had at the time of placement an ISQ value of 74. But over time, this particular implant had an ISQ value of 30 that decreased quite a bit. And so, this really, I would say, is more of a failing than ailing, because going from 74 to 30 is pretty significant decline. And so really gave me the impetus to actually remove this implant, and before it started to get more inflamed and infected and potentially even affect the adjacent implants. And so this is a really nice tool that can help you to identify those implants.